office is going to be down here in a few minutes to talk to us, and someone from Wyden's office is going to be down here. Both of them will talk to us and answer some questions. I guess as you read, the CBO score came out to be absolutely horrendous. As of 2026, 54 million Americans total will be uninsured. That includes everyone uninsured now and, as a result of the health care plan. So that's 56 million Americans. 19% of Americans will not have health insurance in 2026 if this plan is enacted. That's why we're out here. The estimate is by 2020, between 21 and 24 million will be uninsured. And that's a whole lot of Americans. $880 billion will be taken from Medicaid over the next 10 years to pay for this plan. So it takes money out of Medicare, it takes money out of every single health care funding you can imagine. This plan is beyond what we could imagine. The score was much worse than they could imagine. So that's why we're out here. We're out here to let them know that we absolutely will not accept this. We urge Congressman Blumenauer and Senator Wyden to do whatever they can to make this not happen. We're also calling about a single-payer health plan that we would like to see enacted that would ensure health care for all. Thank you everyone for coming, and they should be out here soon.
Yeah, I just want to say thank you all so much for coming and expressing your support for the Congressman's actions. I didn't really have a statement prepared or anything, but I'm just glad to see you all being here and showing your support. So thanks so much for coming. I'm just happy to see the level of engagement. So I'm not the Q&A person for the office on this topic or anything. So you're welcome to give us a call and ask questions in particular. Sorry, I'm not really able to answer questions.
Can I ask a general question?
Sure.
Is the representative in favor of voting against this? The healthcare?
The Congressman's been working hard to support the Affordable Care Act and using all the tools available to him to make sure to oppose the new proposed legislation. So, so thank you all for being here.
One more, while we have you, are you able to speak on his Trump Act or the amendment, the 25th Amendment stuff he's working on, Blumenauer, or is there anything is he involved at all in the healthcare defense, or do you know what he's up to with his legislation?
Yes, I recognize their key cameras.
So one thing I think we don't like to do is we don't like to thank Congressman Blumenauer for supporting HR 676, which is a single payer bill. So we would like to extend that thank you to him.
Okay, well thanks so much for expressing your support. You're welcome to call or reach out anytime to let us know. And
when's he back in his office?
He is back in DC right now, and
His Portland office.
His Portland office. I don't know off the top of my head, but he did do a public forum last weekend, and so
is it on the website?
Excited. It'll be on the website whenever he's having any other public events. But we're excited for your support. So
what we appreciate him is the fact that he's in the forefront of not only boycotting the inauguration, he's also trying to lead the front on getting some kind of 25th Amendment worked out, where they actually could have something that they might be able to move on in a way to get some kind of impeachment process going. He's also introduced the Trump Act recently, which is trying to hold accountable all the extra expenses that are going on. So if anything, we're really, in Portland and District 3, we're really happy and proud to have Blumenauer. I know I am. I think I can also say Wyden is one of my favorite guys. I met him 20 years ago when he first came into office. And we're so happy to have them here. But we also need to hear their voice and specifically what they are doing. So anyone who tracks Blumenauer, he recently did send a statement. He sent an email to supporters, and some of us might have seen it, saying here's exactly how I feel about the CBO numbers, how ridiculous it's 10 million the first year, and he said 24 million in 2020. So I think we need to let everyone know, and my voice, I want to let people know that this stain is on the Republican Congress and anyone who supports him right now, and how ridiculous and how hypocrisy is continuing to build. It makes it unacceptable, especially in my America, where love wins, and as Blumenauer loves to have that sign. I know I have that sign. We have that sign, and so we're going to stand up for what we believe in, and we support our reps who stand up for our values. And it's our chance to say, for if you're elected to represent us, we're going to make sure you actually do. And that's the message that we're going to keep pushing. So I'm glad to see everyone out here now, and we're going to hopefully hear from Wyden's representative And we're just fortunate to have some of the good guys, so we don't have to yell at them do their job. We appreciate you.
We
for
can say
doing your
thank
job.
you.
Yeah.
Senator Wyden in his last newsletter, how many of you get his newsletters? His last newsletter basically said, healthcare is a human right. So knowing that Senator Wyden believes this, we want to really push him to say, could you please support 676 and single payer efforts? So any effort to do that would be great. Again, they will be down here in a few minutes to answer some questions and talk to us. And if anyone else has anything they want to contribute or add for a minute or two about healthcare, go for it.
What's 676? About
676 is a single payer bill that was initiated by Representative John Conyers back in, I think, the 70s or 80s, a long time ago. It's been sitting there. It got a lot of attention because of Bernie Sanders' campaign and his support for single payer. Blumenauer signed on, and slowly people are starting to sign on. I was at Suzanne Bonamici's town hall yesterday, and someone asked her about 676, and she actually said, and these were her words, that if anyone has any ideas for greater access to health care, she's willing to look at it. So she did commit to look at 676. And we need to hold her to it if you're in her district, or even if not, let her know we're going to hold her to that statement to take a look at it and examine it. Because at this point, I think single payer is really our only option to get everyone covered.
Could you comment on Walden's role in Trump care?
Well, Wyden is basically supporting the Trump care, and so it's going to be dependent on people in his district to rally any answers. They're having a hard time getting him to town hall meetings. I think they had an event where they plastered his office the other day with notices to try to get him out. So that's another story and something that we have to give support to people in Walden's district to do.
I think he helped design this Trump care.
I wouldn't be surprised.
Yeah.
So if we're not in his district, though, we can't really,
Effective.
be very effective.
You can call his office. There is something written in there somewhere saying even though you're not in a representative's or senator's office, that they do in fact represent everyone.
In the
So
state.
in a sense, all of your representatives do represent all of you. So you definitely should be making your voices heard. They may ask you what your zip code is or where you live, and then, they may have an opinion about that. But sometimes they'll just answer your phone and say thank you. So it wouldn't hurt to call.
It's always been my understanding that that a congressman does not pay really any attention to somebody from outside the district if they know they're from outside the district. But it has occurred to me that somebody like Paul Ryan, who has national ambitions, there might be some point in contacting him.
That's something that affects all of us. And a congressman, that's something that affects all of us. Then,
Yeah, we can't block access.
then I think we should be able to.
Well, we're able to, I'm just saying, I'm not sure they care.
Yeah, right.
Steve King, he's
Right.
never gonna run for anything but Congress.
Right.
But Paul Ryan wants to.
Yeah.
I've contacted McConnell and Paul Ryan. Neither one of them has responded to me at all.
I wouldn't expect him to respond, I'm just
And I
saying that
doubt
he makes their
But they
lives
keep a tally of how many contacts.
But what they do is they forward your, or whatever you sent, your letter, to your congressperson, which I already sent to them anyway. So
My name is Grace Stratton. I'm a field representative for Senator Wyden, and on his behalf, I want to come down and read a statement which he publicly released right after the CBO score came out. The CBO score confirms what many feared. Trump care is an awful deal for the American people. It will leave 24 million Americans in the cold with no health insurance, despite promises that everybody would be covered. I'm going to cut off right there and quickly explain that 24 million is uninsured as a direct result of this. You may have seen larger numbers. That would be total uninsured if you include those, but these would be the newly uninsured alone, not even including those who have not even been able to get access or wouldn't continue to get access. It would raise out-of-pocket costs by thousands of dollars for many more, especially older Americans, despite promises that nobody would be worse off financially. Trump care pulls the plug on Medicaid by cutting $880 billion from the program, threatening care for seniors who need nursing home and home-based care, children, individuals with disabilities, and many others. So Senator Wyden is committed to fighting this. He went to the floor and made a much longer statement than what I just read, and I would love to share that link so that can be shared with you all. I wanted to be sure that you all had seen all of his statements, including specifics. So I just want to thank you all so much, and I actually was going to bring a sign-up sheet, and now I realize that I had forgotten that, so I can certainly connect with you, or also I've got some general business cards. I really encourage folks, if you have more questions, Senator releases on his website his press statements, but also full floor speeches, so you can see the entirety in which he has reflected on this. So
What
thank
can
you.
we do as constituents? There's a lot of anger, a lot of
Yes.
fear. As constituents, what can we do to make sure this doesn't happen? Because this will be totally unacceptable to all of us.
It'll be devastating, which the senator realizes. This is very challenging, and I understand. I think what's always helpful, and I've said this to a lot of my indivisible folks, is the extent that you have friends, family, others that are out in other areas talking about this. They may not have as many people like you all that can come around their community, but there are people out there. And I think the more information that's shared about the real impact of this, the more important it is to share that information with others and spread that across the way. There is a lot of power in mobilizing in your local communities, and the more that you all can do that and encourage friends and family to do that in other areas, in other states, it is very helpful. And continue to contact our staff and our offices. We continue to collect stories of individuals who have been impacted. It's heartbreaking, but it really does help us in trying to continue to show the very real human impact. These are not just numbers, these are people. That's also very helpful for us in pushing back, and I think hopefully helpful for you all to know that you have that resource to come to us. So
One of the ideas that were put forward was for people to contact people in Republican districts like Walden's and other states.
Yes,
And
yes.
try to mobilize even
Yes.
Republicans in those districts to try to contact their legislators. Do you think that would be helpful?
100% yes. To the extent that you can continue to encourage people who have the similar views in these other areas, the better. And that goes across this our own state, and it goes across other states as well, because what we're talking about, like I said, is real human impact, and we want people to be fully realizing what that means. So education is also helpful as well. So if you have detailed questions, I know Lisa, you had a couple questions in particular about what those numbers meant, which is why I wanted to pause and clarify. We're happy to clarify anything that you have questions about, especially since you have such large networks and are trying to share a lot of this information as well. That's also very helpful for us. The more you can continue to get the word out and show that we're not just saying this, it's other people. We are speaking on behalf of Oregonians that have called us time and time again that they are concerned about their health care.
So something I heard today on the news was somebody was arguing that the CBO report was only reflective of the first of the 3 phases. And I don't know if you know anything about the other 2 phases.
Yeah.
So I'm wondering if that's true.
I don't have all the answers, and in fact, I know we've got our news cameras here. I was going to offer that Hank Stern, our press secretary, is upstairs if you want more of an official statement on any of this stuff. So I should probably pause and but I can find out about that exact. That's a great question, sort of what the phases mean, what impact's going to be, how quickly it's going to come on. A lot of this is shifting, so we're continuing to be trying to figure it out as well.
The other question I'm wondering about is what's the push to get this through so quickly before it's really being digested? It's like there's this shove to get it done very quickly, and I don't understand that.
Yeah, I mean, I think that this is something that's campaign promise, and so there's a lot of effort now to want to fulfill that, because there were people that were, impacted by the previous health care bill. My guess is that, that's part of the promise that they want to fulfill, and push it.
Need to be done in the first 3 months or something?
I can't speak on behalf of the party and what their political goals are. I'm just saying a lot of what I've heard, and I think you've heard it. I'm just actually repeating a lot of what I've even heard the press report, is that there was a lot of pressure coming from an administration, and then that was impacting the members, and then they were trying to work really hard to find something that would work.
Do you
So
have an
that's what
idea
I would
of
be
how
for.
many of the 24 million would be children?
I don't. I do not know that. That's a fantastic question, and that's something else I actually wanted to mention to caveat in terms of efforts and what you can do. A lot of organizations have a serious stake in this as well, that are national, but they have local chapters. I've been meeting with a lot of our healthcare organizations, and they may have numbers on that, or they may be starting to investigate that or ask their national to find that out. So I would highly encourage, the extent that you all can connect with programs that serve children, for example, individuals with disabilities, seniors, all that, they are starting to dissect this as well, and you might be able to also find another leverage point of what this impact means.
Because I really believe that some people don't really care about adults or the aging, but they might care about little kids.
Yeah.
You know,
Yeah.
because
certainly.
they haven't done anything, to deserve that. I'm just saying it, as far as getting to people's commonality into their hearts.
I did hear this morning on NPR from a family and children's service expert that 40% of children in America are on Medicaid.
I heard that too.
So that's pretty serious.
Yeah.
Yeah.
Thank you. Yeah, thank you for sharing that. There's certainly a lot of statistics that are being looked at right. I do have to run back upstairs, but if people want to come and talk to me individually really quickly, I can do that before we head out.
Can I just ask a quick question about what Mr. Wyden's view is on the national popular vote?
The National Popular Vote, I don't have a proof statement to actually read for you about that, but I can have you follow up individually. Yeah, absolutely. Great, fine question. I am not the official press person, so.